Let's talk about a really frustrating reality for a lot of men, when the treatments you try for erectile dysfunction just don't seem to work. But what if the treatment isn't really the problem? What if you're just using the wrong tool for the job? Well, today, we're going to dive into what's often the real, underlying cause and a modern solution that's designed to fix it for good.
So let me just ask you straight up. Does this feel familiar? You've tried the pills, you've done what you're supposed to do, but you're just not getting those consistent, lasting results you were hoping for? I get it. It can be incredibly frustrating. And if you're kind of nodding along to any of these points you see here, I want you to know you are definitely not alone. That feeling of an erection just fading away too fast or the pills only doing half the job, it just creates this awful cycle of stress and, yeah, a real loss of confidence. So many guys feel like they've hit a total wall, like they've tried everything and nothing is working.
Okay, so this brings us to the big question, right? Why don't these standard treatments always work like they're supposed to? It's really easy to start thinking the problem is with you, but the answer is usually much, much simpler. The treatment just wasn't built to fix the specific problem you're actually having.
Here's the most important thing to get. Pills for ED have a very specific job to do. They're designed to handle one part of the whole equation. But if your issue is fundamentally a mechanical one, well then, those pills are just the wrong tool for the job. It's really no surprise that they're falling short.
And that right there brings us to the real culprit for so many men. This underdiagnosed mechanical issue called a venous leak. For a lot of guys who haven't had any luck with other treatments, this is the missing piece of the puzzle.
So what is it exactly? Let me break it down. For a normal erection, you need blood to flow in and then stay trapped. Simple enough. But with a venous leak, the blood flows in just fine, but it leaks right back out through these faulty veins. This makes it almost impossible to keep a firm erection no matter how aroused you are. It's a physical issue, a plumbing issue, not something that's just in your head.
The absolute best way to understand this is to think of it just like a simple plumbing problem. Seriously, once you get this analogy, everything else is going to click into place.
Now look at this, because this slide really lays out the disconnect perfectly. On one side, you've got ED pills. Their job, to increase blood inflow. They basically just open the tap wider to get more water flowing into the pipe. But with a venous leak, the inflow isn't the problem at all. The real problem is that the pipe itself is leaking. You've got uncontrolled blood outflow.
And this right here, this says it all. It's such a simple but really powerful idea. You can't fix a leaky pipe by just turning up the water pressure. It makes total sense, right? All that extra force from the pills just makes the leak worse. The only way to really fix it is to patch the leak in the pipe itself. So, how in the world do you fix the leak? Well, this is where modern medicine offers a truly targeted, amazing solution. Instead of just trying to manage the symptoms, we can now go in and treat the root cause directly.
It's a procedure called venous leak embolization. This is a minimally invasive technique that doesn't try to just overpower the problem. Nope, it's designed with incredible precision to go in, find, and seal off the exact veins that are causing the leak.
Okay, so what does this procedure actually look like? The name might sound a little complex, but the approach itself is surprisingly straightforward and, honestly, pretty elegant. It uses advanced imaging to guide every single step. Let's just walk through it. It all starts with a tiny little pinhole access point. We're not talking about big incisions here. From that spot, a doctor uses a live X-ray, almost like a GPS for your body, to navigate a tiny, flexible tube right to the source of the problem. Then, they place these little microscopic coils to seal off only the faulty leaking veins, leaving all the healthy ones to do their job. And that's it. The catheter comes out and the whole thing is covered with just a small bandage. Done.
And the benefits of doing it this way are huge. Think about this. We're talking about a procedure with no general anesthesia, no stitches to worry about, and you get to go home the very same day. It's a completely different world from traditional, invasive surgery.
All right, so the procedure itself is pretty incredible. But who's it for, and what's life like afterward? Let's take a look at who makes a good candidate and what that recovery path is really like. Just take a look at this list and see if any of it rings a bell for you. This is a fantastic option for any guy who's been let down by the pills. It's for anyone who wants to stop just putting a Band-Aid on the symptoms and finally deal with the actual root cause of their ED. And it's a really important option for men who want to avoid major surgery like a penile implant. And the recovery timeline? It's just as impressive. You're home on the same day, and you're pretty much back to your normal, non-strenuous routine within a day or two. Now, it's really important to note that the improvement is gradual. This isn't some instant magic fix. The procedure works with your body, so you'll start to notice real, steady improvement over the next few weeks as your system adapts and heals properly.
And this slide says it all, doesn't it? 0. That is the number of surgical implants, permanent hardware, or big incisions you need for this procedure. It's just a powerful, powerful statement about how far medical technology has come.
So I'll just leave you with this question. After all the frustration, after trying solutions that just couldn't get to the real problem, it's worth asking yourself, are you ready to finally fix the leak? For so many men, this approach has been the answer they've been searching for all along.
Let's